interviews too. So that's cool. And all of this is great information for both current and future applicants, which leads us to the next question, which is tips, advice. Knowing what you know now and what you just experienced these last 4 months of flying back and forth, coordinating and preparing for your interview days, putting your application together, all of these things. Knowing what you know now, what are 4 or 5 tips that future and candidates of pediatric dentistry for residency program that they must know, that they must follow, that they must do right now?
Right. No, that's a great question. And to narrow it down to 4 or 5 may be a little difficult, but I'll do it for sure.
Well,
But
give us what you got, man. I mean, you the
I can,
expert now.
yeah,
You're
I can
the
do that.
application expert now.
Yeah. No, it's just because like even right now, as I think about where like me having this interview with you, it's kind of like, well, I vividly remember last summer, like thinking about or watching your videos with someone else who matched into Peds residency. And it's like I remember like, oh, I can't wait for my day to come. And here it is, very full circle moment. But when it comes to tips and advice for anyone who's watching this, who's interested in Peds or any other specialty. But the number one piece of advice for sure that I would give anyone who is applying right now is to just try. And the reason I say just try is because for me, I I wasn't sure what would happen, and no one never knows what will happen. You can have the best grades, you can have not so, dean's list grades or whatever, and you can have a great application, you can have a kind of like a shorter application, and you don't know what's going to happen, But as long as you try, you should try because you never know like what the end result will be. For me, being fully transparent. When it came to UIC was like that school, like I said earlier, where they just like shined in my eyes. And I wasn't even about to apply to UIC because in my mind, I told myself, oh, Malik, your chances aren't that great, right? So I told myself, maybe you shouldn't even apply. Don't waste your money because this application process is expensive. But I went ahead and applied per the suggestion and recommendations from my mentor, who told me you might as well just apply, and you never know what will happen. And here I am, going to UIC. So definitely, I would advise people and encourage people to try their best and just give it a shot because at the end of the day, the worst thing, like the absolute worst thing anyone can say is no, but you won't know unless you try. So outside of trying, I would say get connected slash network. And what I mean by that is, reach out to local pediatric dentists who you are interested in shadowing at your school. If there's a pedo department, be in there as much as you can. Express your interest to the chair of the department, to the associate professors in that department. When it comes to doing externships at potential programs that you're interested in, go on the AAPD's website. They have like it's very well organized actually. Like they have a list of all the externships, all the programs, when their externships are, who you need to contact. Spend time doing all of that because at the end of the day, what became very evident to me during this process, what matters the most is who you know. Like it just you need to know like if you know people who are, let's say, on the other side, they can really help you, can help you navigate this entire process. And that was very beneficial for me. So I would say that. And then also I would say, to be honest with yourself as you are creating your application, going through your application materials. And when I say honest, I don't mean like, oh, be honest in your application because you should be honest, of course. Like definitely don't lie, in anything that you write in your application because on a couple of my interviews, they asked me questions directly off of what I said in my like personal statement or in my CV. So don't lie in that. Like I'm not saying I'm talking about honesty in that sense. I'm talking about honesty in the sense of know your strengths and know your weaknesses. Like when you are applying, know what it is that you like, know your why essentially. Like are you honestly interested in peds? If so, why? Be able to articulate that, you know, just be honest with yourself, because I feel like doing that will like ultimately help you create the strongest application if you are honest with yourself, and as opposed to just like, you know, in your mind saying, oh, I'm going to write this because I think this is going to sound good, even though you know deep down that's not how you truly feel. Like in your personal statement, if you say, oh, I really have a passion for doing X, Y, and Z, but you know that you don't have a passion for X, Y, and Z, don't write it in your personal statement, because if you get an interview and then they ask you about X, Y, and Z, it's going to become very clear that you were not genuinely like being yourself and being honest when you said that. So those are the biggest three things I would say, is just try your best, or try network slash get involved, and then also be honest.
Yeah, man, that first step, that first one is key, because nothing happens until you decide, right?
Exactly.
You got to decide, and you can't, and your decision to become a board certified pediatric dentist or a
Mm,
specialist and to apply to the residency program, that decision can't be a decision that you don't make because you don't know if it's going to happen or not. Well,
exactly.
we don't know how the 4 years of dental school is going to go. All we know is it's going to be hard based on what people have told us, right? But you don't,
Mm,
I mean, but you can't predict it to the point where you're trying to control it, to the point where you're going to say, you know what? No, I'm not going to do it now,
right.
which is a decision, but it's not the mindset that you want to have when you're deciding and going on to something bigger and better. So
Exactly.
yes, there's going to be some parts of it that you're not going to know, and there's going to be some unknowingness, and you're going to have to go on the faith of the tooth fairy that she will, guide you through. But
Right.
you also got to get yourself out of the way, right? And not be worried about, well, I don't know if I'm strong candidate. I don't know. I don't know. Yeah, you will never know, especially if you don't apply.
Exactly.
You don't know. So that first one is like the highlight for me, man. Because you've got to decide. Everything that we do or don't do is based on a decision.
Exactly.
That's where everything starts or stops. It's
Mm,
based on the first thing, which is a decision. So that number one thing that you said is a number one thing is definitely the number one thing, in the sense that you got to decide and then just do,
let's do
and
it.
then go through the process.
Exactly.
That's a big one for me, man. Staying connected, being connected, networking. Yes, GPA helps, but so does knowing Dr. So, Dr. B, Dr. C, and Dr. D.
Sure does. Yeah, literally. Literally.
Literally.
Also, just like just comes to mind, you know, another advice. A lot of times I know people when they're applying for PEDS or any specialty, the GPA is something that, like for myself, like I put that at the forefront of everything. I was like, oh, Malik, your GPA, it may hurt you like during this process, this, that, and the third. But just from my own experience, and I feel like this would help someone out there who will eventually watch this. It's like when in all of my 7 interviews, not once did any of my interviewers ask me about my GPA.
Yeah,
Not one.
yeah.
And for me, that was very like surprising, because I had told for months, Dr. Darwin, I told myself, oh, Malik, be prepared to defend your GPA. Like, be prepared to answer questions like, oh, why did you not do well in this class, that class? But it wasn't like that at all. And for me, that was that like confirmation that I needed, that Malik, you're more than just your grades. Grades will help, you know, get a person into a door for sure, but grades will not determine how great of a pediatric dentist a person will become. At least that's my personal opinion. But yeah, I
Man,
just had
I
that.
love that too.
Mhm.
I love that too. Did y'all hear that? You are not just your grades. You are just not your GPA. yes, the programs will look at it, and they may not ask you any questions about it because they have it right in front of you, but it also tells you that GPA is not everything.
It really isn't.
Because guess what the patients won't do? They're not going to ask you what your GPA was in dental school. Dr.
Nope.
Hayes, Dr. Walter, what was your GPA? And use that as a determination whether or not you're going to treat their child or treat them. No. When you sit for that board certification, the written and the clinical part, they're not going to ask you what was your GPA. They're going to ask you some points about what's in the research and how would you use that to treat this condition that this patient has. They're not asking you your GPA to become a board certified pediatric dentist.
They know that.
Yeah. So let's unhang ourselves from the position of putting ourselves up against the wall and being our own deterrent when we're putting together our application. Yes, GPA matters, but it's not everything.
Not.
It is what it is. You are not your GPA.
Exactly.
You are a professional who continues to learn.
Exactly.
And will continue to learn, even as a board certified pediatric dentist, right?